Hi there, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. The topic is it risky to do an intrathecal stem cell procedure? Now, a lot of people who have treatment with us internationally who have a central nervous system issue, such as post-stroke, Alzheimer's, Parkinsons, traumatic brain injury, you understand, maybe something in children like autism or cerebral palsy, they receive an intrathecal application of stem cells. Now, what is that? Well, intrathecal means into the spinal cord, or as it's called in textbooks, the dural sac, the thecal sac, and it involves an anesthesiologist doing an injection in the low back, so it's actually below the level of the spinal cord, into the thecal sac, and anesthesiologists do this all the time. And they do it, for spinal taps, right? They put the needle into the thecal sac, they get some of the cerebral spinal fluid out, and they send it to the lab for evaluation. Except in this case, it's a reverse spinal tap, because they make sure that they're in the right space, that there's a drop or two of cerebrospinal fluid coming out, and they put the stem cells into the thecal sac. And then by gravity, it will go to the brain, and we can avoid the blood-brain barrier. When we give stem cells through an IV drip approach, only about 1 to 2% of those cells are able to get through the blood-brain barrier. Now, exosomes have no problem getting through a blood-brain barrier, okay? They're so small that they don't get caught up, all right? But this is a great way, with cells being 100 times larger than exosomes, to get or bypass the blood-brain barrier. But it sounds risky, right? You're putting a long needle into the spinal cord. Are there risks associated with that? Well, there was a nice study a year and a half ago out of a journal called Current Stem Cell Research and Therapies, where the authors looked at 39 studies evaluating mesenchymal stem cells being given through an intrathecal approach for any number of conditions. Now, these 39 studies that they statistically evaluated together had many hundreds of patients as a total, and they found 0 serious adverse events. None. They were very safe. Now, it backs up what we've been doing for over 10 years now internationally, where we have not had serious adverse events. We have had minor to moderate adverse events, such as dizziness, lightheadedness, maybe a little nausea, possibly some vomiting, maybe a low-grade fever or some chills. These things resolve typically within a few hours, maybe upwards of a day, but we have not seen any long-term adverse events. We've never seen a rejection of the cells. We've never seen a tumor formation. That does not happen with mesenchymal stem cells. There is no evidence that mesenchymal stem cells lead to tumor formation. So I wanted to clear that up, that intrathecal administration has been shown, not just in our experience, but through many, many studies, to be very safe and remarkably free of serious adverse events. All right, visit us online today at r3stemcell.com. R3 has clinics in 7 countries, over 70 centers. It's bound to be one close to you, okay? We offer free consultations. Just give us a call at +1 844-GET-STEM, or you can email us at info@r3stemcell.com.